We're headed into the last week of Mental Health Awareness Month, dedicated to starting conversations and breaking down stigmas. Emma McDarris joins us after speaking to a woman who's using her experience to help others. Emma.
Francis, along with Mental Health Awareness Month, today is World Schizophrenia Awareness Day. I spoke with Sam Goblitz, who was diagnosed with disorganized schizophrenia at 25. She shared the common misconceptions about the illness.
He was diagnosed with disorganized schizophrenia at 25.
Sam Goblitz says one stigma she runs into most is the assumption that schizophrenia means violence.
I can say that the condition is highly stigmatized. We're portrayed in horror movies and, featured as violent characters, when actually people on the schizophrenic spectrum are 14 times more likely to be the victim of assault than the perpetrator.
She says schizophrenia can look different from person to person, so symptoms, needs, and recovery don't follow one script.
More positive symptoms is paranoid schizophrenia. More negative symptoms is catatonic schizophrenia. And then disorganized schizophrenia is more cognitive symptoms. And then affective is like schizoaffective disorder. And then there's even schizotypal and schizoid disorder, and those are personality disorders.
Goblitz is a volunteer with the Ozarks Area Crisis Intervention Team, and she leads the NAMI Southwest Missouri's Schizophrenia Schizoaffective Peer Support Group. She says even while working in mental health, stigma made it hard to be open about her own diagnosis.
Working in the field, I felt that I had to hide my diagnosis. I thought that it would undermine my credibility.
Now she says connecting with others who understand the experience has been a key part of her recovery, and a reminder that people with schizophrenia are living full lives.
To be surrounded by people with the same diagnosis was very reassuring for me. It was a big piece of my recovery because we're all living our lives.
NAMI has all of these resources on their website about schizophrenia that can help you understand the illness better and find support. And you can find that link on this story on KY3.com. Francis.
Very good. Thanks so much, Emma.